Well, good morning, everybody. My name is Mark Hooley. I serve as the Director of the Department of Safety Division of Fire Standards and Training and Emergency Medical Services. On behalf of Commissioner Robert Quinn, our two Assistant Commissioners, Eddie Edwards and Steve Lavoie, I'd like to welcome you to the Richard M. Flynn Fire Academy for this afternoon's press conference as we mark the beginning of the examination phase of the State of New Hampshire's Firefighter First screening pilot program. Before we begin, a couple of safety notices. This building is staffed with a fully functioning fire alarm system. If the alarms do go off, even though most of us are firefighters, we could exit on either end of the building and let the Concord Fire Department come and do what they do so well. At 0700 this morning, we welcomed our first two participants of this groundbreaking cancer screening pilot program in the state of New Hampshire. These two participants walked onto our campus and did their appointments was the culmination of years of collaboration between the state of New Hampshire, the legislative process, the mission of the Professional Firefighters of New Hampshire and the IAFF, and the leadership of the New Hampshire Fire Chiefs Association. To begin our remarks, I'm honored to introduce a true supporter of the New Hampshire firefighters, the Governor of the state of New Hampshire, the Honorable Kelly Ayotte.
Well, first of all, I want to thank Director Hooley for all his great work here. I want to thank the Commissioner of the Department of Safety, Commissioner Quinn, and the Assistant Commissioners who are here, Lavoie and Edwards. And I want to thank very much all of our firefighters who are here today for what you do. You do an incredible job. Just the things that you deal with day in, day out. Thank you to your families. There's a lot of hazards in this job, and we're really grateful for you. I want to thank the leadership. It's great to have the leadership who's here, from Brian Reel from the Professional Firefighters in New Hampshire, and I want to thank Brian in particular. He and I have had a lot of great collaboration on important work for public safety in the state, and I'm grateful for that. And Jake Colbert, who's here from the International Firefighters Association, the president of that association. It tells you the importance of what we're doing here today. Most of all, we're really honored to have retired Deputy Chief Glenn Telgen here from my hometown of Nashua, who himself is right now fighting cancer, but it tells you the importance of this issue, and I want to thank him for his courage and for being here and for his incredible service to my hometown city and to our state. We're really blessed to have you. But it really exemplifies how important this is. This is, New Hampshire leads in so many ways to have this screening, cancer screenings up front for our firefighters, emergency personnel. Firefighters, too many of them are dying too young from cancer. Obviously there's other causes too, but cancer has been a big one for our firefighters. And to have New Hampshire leading, to have that early screening, that early detection is critical, and that's what this program is going to do. This is very key. We want to get the word out. We want people to get tested. Please get your screening early so that we can understand what's happening, so that we can prevent you from having cancer, or get it early so that we can save your life. And to every firefighter who's out there, thank you for doing what you do, for the hazards that you face every day on our behalf. This is the least we can do, and this early screening, we want everyone to get in, get it done, so that we can get you, if you need assistance, medical assistance, we get it to you. And also that peace of mind of having that screening done too. And this isn't a one-time thing, right? You get your screening, please continue to get the screening. This is so important so that we can save lives of those who save our lives every single day. Thank you for having me.
Thank you, Governor. My boss is Commissioner Robert Quinn. From the people in this room and the fire service, there's no better person to lead the mission of safety in the state than the Commissioner Quinn. He oversees 7 divisions, all united in one mission, that is to serve the state of New Hampshire. He's as genuine as a person I've ever worked for, and it's my honor to represent and have come up Commissioner Robert Quinn.
Well, thank you, Governor Ayotte and Director Hooley, and thank all of you who've come and joined us here today. This has been years in the making. It all started with a working group of members from the New Hampshire Department of Safety, Division of Fire Standards and Training and EMS, the Professional Firefighters in New Hampshire, the New Hampshire Association of Fire Chiefs. They worked very hard. The committee oversaw the development of the cancer screening plan. The plan was ultimately presented and approved by the governor, and the funding was approved by the legislature. I want to thank them both for their leadership and their support. Late last year, the program came to life with the approval of vendor contracts, and today we're here to officially celebrate the kickoff of this testing. This pilot program was established for active and retired full-time firefighters and was intentionally designed to screen for any and all cancers. The blood test is comprehensive and screens for many common signs of cancer, and the ultrasound images several organs where cancer could appear. The lung test is the only test aiming at specific kinds of cancer in the lungs. The goal of this program is to test for as many signs of cancer as possible, including cancers uncommonly tested for. You know better than I, your job is dangerous enough. It's only right to support our firefighters who encounter these cancer-causing elements in the course of their duties. I wish you all the very best. God bless you in your treatment. Thank you.
Before we start bringing up the people who champion this program, I want to give you a brief overview of how we got here today. Senate Bill 352 was introduced by Senator Sharon Carson in January of 2024. It passed the House and the Senate in spring of 24, gaining support along the way thanks to the collaboration of the Professional Firefighters of New Hampshire and the New Hampshire Fire Chiefs Association. Governor Chris Sununu signed the bill into law at a ceremony held at Manchester Fire Headquarters, an event that was hosted by Fire Chief Ryan Cashin on July 2nd, 2024. The study that the Commissioner referenced, Assistant Commissioner Steve Lavoie, previous Director of the Division of Fire Standards and Training, Justin Cutting, the Assistant Director, Jeff Phillips, Brian Reel from the Professional Firefighters of New Hampshire, John McAllister, and Jeb Carpenter. From the New Hampshire Fire Chiefs, Chief Steve Buxton. The RFQs were built, proposals were graded, and on December 17th, 2025, Governor Ayotte and the Executive Council passed two contracts, one to United Diagnostic Services and one to Grail. Together, these two companies will service the state of New Hampshire for the next 24 months, ensuring every eligible firefighter that wants to be tested is given that opportunity. Within days of passing the contracts, leadership here at the division was tasked with the logistics of running the program, and then our work began. Assistant Director Jeff Phillips has served as our main contact, and to tell you that every single day since the contracts have been passed, he has dealt with emails, texts, or phone calls related to this program, and his work has been commendable. I thank you, Jeff, for your leadership and your assistance. So what does a $5 million investment into firefighter wellness by the state of New Hampshire look like? Well, in the month of January, logistics. In the month of February, focusing on education of those eligible members that were going to be part of this program. It was hosted by our third-party administrator, the CEO of UDS, Ray Larkin. Over 450 people participated in those educational ceremonies, educational sessions. In March, we thought it would be our opportunity to use an entire month to register. And the New Hampshire Fire Service never ceases to amaze. In 48 hours, from March 1st, in 48 hours, 1,203 appointments were fully booked in 48 hours. Today, phase one, our first exams. And what comes next? Well, phase two, August of 2026, we will open the next round of exams, a program similar to what we have here. 7 weeks, 6 days a week, 1,203 additional appointments. And we run the same program in 2027. And while those numbers I spoke about are really important details, this program is not just about numbers. It's about people. It's about the men and women who serve the New Hampshire Fire Service, who serve their communities, and do so because the service to others was their calling in life. A service that drove them to the fire service because it was the only honorable way to meet that need. So if you're in the room, I ask you to raise your hand if you've ever lost a brother or sister firefighter to cancer. Keep your hands up if you've lost a firefighter who has died from occupational cancer. And raise your hand if you are a firefighter battling occupational cancer. Look around this room. The hands that were up is what this program is all about. This program is about people like Sarah Fox from the Portsmouth Fire Department, and Kyle Jamison from Hampton, and Darren Sabin from Newington, and Jess Wyman from Nashua, and Aaron Cooper from Keene. These folks lost their battles. But this program is also about Jason Lambert, Eric Battistelli, Zach O'Brien, Elisa Folsom, and Mark Hebert. These folks continue to fight. Folks like Glenn Telgen, who the governor introduced, who was recently retired from the National Fire Department just over a month ago. Retired at the age of 46 because he had to focus on his battle with pancreatic cancer. Glenn was one of the first people I had the opportunity to meet when I started my fire service career, literally the first day. 30 years ago, we graduated from this academy on that drill yard and our recruit class together. There is no better firefighter out there than Glenn. There was no one better to work a fire on a hose line than with him. There was no better officer in the fire service that would have his crew ready than him. And when we served as chief officers, there was no one better to stand next to at a building fire than him. And cancer has no idea the person that it picked to fight when it picked Glenn Telgen. I asked Glenn and his wife Ashley if they could join us today, because the numbers are important, but the people are more important. And the faces that have this battle are just as important. I offer now that Deputy Chief Glenn Telgen offer just a few remarks and share his story so we remember the people and not just the numbers.
Good afternoon. I'd like to begin by thanking the PFF&H, the New Hampshire Association of Firefighters, Governor Kelly Ayotte, and the commissioners and the Director Hooley, and all those who work behind the scenes to help facilitate these exams for our New Hampshire firefighters. A quick introduction. I'm Glenn Telgen, retired Deputy Chief from the National Fire Department. I spent 3 years working full-time in Hudson before crossing the bridge in 2002, where I proudly served the city of Nashua for 23 years. The National Fire Department has been on the cutting edge of health and wellness physicals for the past 5 years. During my years as Deputy Chief, one of the administrative duties was planning, organizing, facilitating the physicals for 170 members of the National Fire Department. From my viewpoint, these exams are critical for 2 reasons. First, they help protect the overall health and wellness of our firefighters. Second, and just as important, they establish a documented baseline and medical history for every single member. Let me elaborate on my 2 reasons. On September 28, 2025, I was diagnosed with stage 4 pancreatic cancer. A few months into treatment with Dana-Farber, I asked, "Are we winning?" To which my physician's assistant said, "I'd say so. Had you not found this when you did, I wouldn't be here today." I share this not for sympathy, but perspective. In my case, I had symptoms. I had a reason to push for further testing. Many firefighters don't. Serious conditions often develop quietly, without warning, until it's too late to intervene effectively. We're all learning that cancer is becoming number 1 of the firefighter fatalities for both active and retired members. That reality brings me to my second point, emphasizing the importance of these exams. I find myself at the beginning stages of workers' compensation battle. My hope is that years of documentation, physicals showing no prior signs of illness will help support this process. Without the medical history, the road becomes much harder. Firefighters are conditioned to take care of everyone else first. These exams are about ensuring we also take care of our own. Last Thursday, Director Hooley called me and asked if I was willing to speak today. This is well outside of my comfort zone. But if sharing my story leads to change for even one firefighter or spares one family from unnecessary hardship, then it was worth it. Thank you.
Thank you, Glenn. Always remember the people. That's the story. The champions that got this program to the state of New Hampshire, you've got to look no further than the professional firefighters of New Hampshire and their president, Brian Reel. Brian, please come forward.
Thank you, Director. Good afternoon. My name is Brian Rill. I'm the president of the Professional Firefighters of New Hampshire. In 2022, the World Health Organization classified firefighting as a Group 1 carcinogen, which is their highest designation, citing clear scientific evidence that our profession causes cancer. Today, it is the leading cause of line-of-duty deaths among firefighters. More than 2/3 of the names added to the IAFF Fallen Firefighter Memorial in 2024 were lost to occupational cancer. That reality is unacceptable. It's unacceptable to us, and it should be unacceptable to anybody at home. Modern firefighting exposes us to carcinogens ranging from toxic smoke produced by synthetic materials to PFAS forever chemicals found in the protective gear that we wear every day. The International Association of Firefighters, under the leadership of General President Ed Kelly, has brought national attention to this crisis by advancing prevention measures, demanding safer standards, and emphasizing the critical importance of early detection. Here in New Hampshire, our elected leaders didn't just acknowledge this reality, they acted, advocating alongside the professional firefighters in New Hampshire to advance groundbreaking occupational cancer legislation. In 2018, our state legislature established and funded long-awaited presumptive cancer law, which was expanded in 2023 to include coverage for all cancers. And in 2024, elected officials worked with fire service leaders to enact progressive and proactive legislation, which appropriated $5 million to launch a comprehensive cancer screening program for nearly 4,000 firefighters across the Granite State. That brings us to today. Today marks the launch of a first-of-its-kind program that combines full-body ultrasound, low-dose lung CT, and multi-cancer early detection blood testing into a single comprehensive screening model. No other program in the country brings all of these components together in this way for this many people, proving that New Hampshire isn't just a part of the conversation, we're leading it. I want to express our deepest gratitude to Senate President Sharon Carson, the prime sponsor of the enabling legislation to get this done, and to all of the co-sponsors who helped turn our vision into a reality. Thank you to former Governor Chris Sununu for his support and advocacy in getting this initiative across the finish line, and to current Governor Kelly Ayotte and her continued leadership and commitment to firefighter health and safety, and for seeing this through. We're also grateful to the New Hampshire Department of Safety under the leadership of Commissioner Quinn, Assistant Commissioner Lavoie, and Assistant Commissioner Edwards, former Fire Standards and Training Director Justin Cutting, and current FST Director Mark Hooley, along with the Assistant Director Jeff Phillips. Additionally, Chief Buxton and his partnership in the New Hampshire Association of Fire Chiefs for helping bring this program to life. Most importantly, we recognize the families and survivors who have shared their personal and heartfelt stories of strength, loss, and resilience. Your voices are the reason we're here today. We hope this program provides you with a sense of comfort and a sense of pride, knowing that your loved ones are not forgotten and that their sacrifices inspired progress and change. This program carries the legacy of firefighters like Kyle Jamison, Darren Sabin, Jeff Bokum, Sarah Fox, Jess Wyman, Dan Pasula, Mark Willett, and so many others who answered the call to serve and in return succumbed to occupational cancer. They are the reason the professional firefighters championed this initiative and the reason we would not stop until it became a reality. Today we honor them not just with words, but with action. By integrating these advanced diagnostic tests, we have built the most comprehensive firefighter cancer screening model in the country. And with the results, we hope to evaluate the outcomes, refine our approach, and build a sustainable, long-term program that ensures ongoing access to early detection for every firefighter in New Hampshire. This program sends a powerful and strong message that New Hampshire protects those that protect New Hampshire. To everyone who made this possible, thank you. Your work has made a lasting impact, and your commitment ensures that firefighters across this state will have earlier detection, better outcomes, and more time with those that they love. As we begin this program today, we do so with a shared responsibility that early detection prevention and survival will become the standard and not the exception. And together we will save lives. Thank you.
Thank you, Brian. Leadership from the International Association of Firefighters fight every single day at the federal level to protect the rights of firefighters. Pretty honored to have with us today the 3rd District Vice President of the IAFF, Jay Colbert.
Thank you, everybody, and thank you for taking the time to come up here and recognize what is really happening here. I'm here on behalf of my General President, Ed Kelly, who is a Boston firefighter. We're both very proud to be from New England, and we're both very proud of what New England is accomplishing in the fight to reduce occupational cancer in the fire service. What's happening in the fire service can only be described as something that is ravaging it. Brian referenced the firefighter memorial out in Colorado, where we put on over 200 names a year. 70 to 75% of those names that we put on every year are due to occupational cancer. That can be nothing short of an epidemic in this business. And it is such an epidemic that our federal government, just this past December, a week before Christmas, now mind you, the federal government can't agree on anything. They can't agree to pay Homeland Security workers during spring break, air travel time. They agreed, bipartisan manner, to put our public safety officers benefit, which awards $461,000 to those of us who are lost to occupational cancer. Now that doesn't bring back their father, their brother, their mother, their daughter, the breadwinner, but it's a commitment from the federal government to show just what type of action is needed to rectify this epidemic. Now make no bones about it, what you did here today is historic. It's historic because it's the first state or province in our international union across 2 great countries to do something with the CT scans, the diagnostic, the ultrasounds, and the blood tests. That trifecta of what you do towards the 4,000 firefighters across New Hampshire is gonna save lives. Unequivocally, it will save lives. And everybody in this room who played a small part in getting us across this end zone to get to this point deserves to be proud. I'm proud to be the representative from New England. I'm proud that the New Hampshire legislature, the New Hampshire Department of Safety, the New Hampshire fire chiefs, the PFFNH, got us to this room today to make this historic bet. And I'll tell you what, everybody in this room should go back and trumpet from the rooftops and the hilltops of New Hampshire what you did today, because it truly is a very, very proud moment for this state. Thank you all very much for coming here.
And representing the New Hampshire Fire Chiefs Association from the Berlin Fire Department, their president, Chief Jay Watkins.
Chief Buxton could not make it today, but on behalf of the Association of Fire Chiefs, we would like to thank Governor Ayotte, along with former Governor Sununu, the legislation, the IAFF, for making this all happen. Firefighters have a personality to put others first, and this bill puts firefighters first. Early detection is such a huge advantage in the battle with cancer. We've all had loved ones who have been diagnosed, and we understand the battle. We encourage all eligible firefighters to sign up and have yourself checked. My hope is this bill is just the beginning, and we can ensure that all firefighters in New Hampshire will have the same opportunity. Thank you.
Thank you so much, Governor Ayotte. Commissioners, IFF, Professional Firefighters of New Hampshire, New Hampshire Fire Chiefs. This is an example of collaboration. This is how you get things done in the state of New Hampshire. I'm grateful for you all and grateful for your leadership. What happens next for us now? Our exams continue for the next 7 weeks. If any exam opportunities open up, they're posted daily, immediately on the website, firefightersfirst.nh.gov. We will open up our exams for our Phase 2, which will happen in September, sometime in the month of August. And based upon what this profession did in the first go-round, I'm sure it will be similar results. I guess that concludes our formal portion of our press conference.